Hey, good morning, everybody. Thank you for attending this month's uh, presentation. This month we'll be talking about counter data. Today is August 28th, 2024. Just to introduce myself, my name is Alvin Batista. I will be your moderator for the month of August. And joining me today will be, we have a couple presenters, or before that, we'll go over today's agenda. So a couple of things we're going to be talking about are DHCS encounter data, how to avoid denied duplicates. We have a presentation on HIPAA mandated standards, implementation, and companion guides. We will have a Q&A session later on, and we'll also talk about communication and resources. So helping me out today, we have a couple presenters. We have Stephen Lefebvre and also Jeff Jennings. And as always, we have to introduce our support team. Myself, I will be your moderator for today. Along with me will be Abby Jeber-Relasi. We have Mei Shan Ing, Xiaoyan Ma, Samantha Van, Soo Jung Kim, and as always, Amy Peterson. Just a couple of housekeeping items for questions. For all general questions, please submit your question to the WebEx chat, and please make sure that your questions are visible for all participants as opposed to sending a private chat to the host. So if you come on, please introduce yourself and where you're from, and you can ask your question there. For specific questions, please reach out to the data mailbox as will be instructed. And as always, we will have the support staff look at the chat throughout the presentation as well. Before we move on, we just want to let you know that today's webinar is going to be recorded. The recorded video, script, and presentation materials will be uploaded to the Quality Webinar Series link as you see on screen. So furthermost, I would like to introduce our first presenter. Today's topic will be DHCS encounter data, how to avoid denied duplicates. So I'm going to hand it over to our first presenter, Stephen Lefebvre from the Data Quality Reporting Unit.
Good morning. My name is Stephen Lefebvre, and I work from the Data Quality Reporting Unit. And I've worked with many of you over the years. I've been in data quality reporting for quite a while. We used to be the counter data quality unit. Now we're the Data Quality Reporting Unit. So, and I've actually given similar speeches, spoken about this many times before. And the reason I've done it is because denied duplicate seems to be like that stone in your shoe. You turn your shoe over and you can't get rid of it. It just never goes away. And well, because it continues to be the top denial reason. My measurement period for this webinar is the past state fiscal year, July 2023 to June 2024. And during that time, I ran a query that estimated 1,596,614 duplicate denials. So that's quite a significant number. So so I also dug a little deeper, and I determined that 40% of these denied duplicates, they were successfully replaced or voided. So that means 60% of these denied duplicates have not been acted upon. So they're just sitting in the database unfinished. So 60%, that equals 956,021, almost a million. That's close to a million. That's just for the past year. Digging even deeper, if I go back, because this is the number one reason, pretty much in perpetuity since the beginning of the project, there are millions, and I mean like tens of millions of these uncorrected denied duplicates in our database. So they've just not been corrected. So if you, we're going to talk a little bit more about all this as we go on. And if you have any questions about denied duplicates, and this is the 000CC error that you'll see in your EVRs, talk to your data quality specialist, your encounter data specialist, and you can reach out to our data quality mailbox. It's actually an encounter data mailbox, and we'll give you that information later on in this slide. So what is a duplicate encounter, a denied duplicate encounter? Well, the PACES system has a series of edits that check values to determine whether or not an encounter is a duplicate. So that's our duplicate logic. And these values are detailed in the encounter encounter data companion guides. And so this is an excerpt from the companion guides. It's not really an excerpt, it's more of a summary of companion guides. So you can reference the PACES duplicate rules and logic in section 3.8 in the Institutional, Professional, and Dental Companion Guides. And NCPDP, that section is 1.8. So if you look, these are the values in, for example, on the left side in institutional, these are the values that the duplicate logic checks. And if all of these items are the same from a previous encounter, then it is denied as tagged and denied as a duplicate. And then you receive that in your EBR. On the right is going to be the professional. I didn't have room to put in the dental and the NCPDP, which you can look those up with the companion. And then somebody's probably wondering, well, why are those items on the left bolded? Well, these are issues that we're going to be dealing with in future webinars and also with future efforts. And we just put them in here just so, just to point them out that these are other issues, but they're not the number one issue, which is duplicates. So I've been really committed to this, lowering the occurrence of duplicate encounters for many years. Back when we were doing our quarterly EDQU webinars, I actually gave a similar presentation probably for about 2 years in a row. That's how important this issue is. That's how prevalent this issue is. So during that webinar and during this webinar, I want to provide some following guidance to help mitigate the denials due to duplicate encounters. So what is a denied duplicate? So for denied duplicate encounters, PACES denotes a duplicate. I'm just going to read this top line. Plans need to determine whether the encounter is a true duplicate. Does it represent the same event as an already submitted encounter? That's kind of the definition. An encounter that represents the same event with the same data as a previously submitted encounter. And if that's what triggers duplicate logic. So if the encounter is obviously not a duplicate, if it's a mistake, it just has the same data, but you know that it's not a duplicate, then you'll need to issue a replacement. A replacement must be submitted for the encounter. And then you would use the appropriate coding, and in this case, modifiers. And the most common modifiers we use are 59, 76, and 77. And when you put in these modifiers into your encounter in the appropriate loop section, then what that'll do is that will let PACES system know to bypass the duplicate logic, because even though these encounters look the same, they're not the same. This is a different encounter. So this allows PACES edits to see the events as distinct encounters instead of the same. The replacement corrects the denied encounter, and it helps us improve our data quality. Data quality is the beginning of our unit name, and the quality of the data in our database is we're starting to look a little deeper into this. That's why I'm kind of doing these analysis and counting them up and how long it's been going on. And so, other issues with duplicates could be impacted by mother newborn reporting, because when there's a newborn, they, for the first, 24 or 48 hours, they use the mother's SIN. So there may be items that look like duplicates, but we actually put out a pretty extensive guidance on mother newborns. We've sent that out several times to plans. If you need that, I believe it's going to be in the, I believe we have it in the documentation center. And I'll mention that. I'll talk about the documentation center in a little bit. So anyway, that kind of summarizes replacements. So replace the encounters. And I have no doubt that the plans are in place in the encounters, because you're required to submit all encounters. And if it was denied, that doesn't mean you just don't submit that encounter. You're still going to be held accountable for reasonability numbers. How many encounters are you submitting the right number of encounters? So you're definitely doing that. But the other side, the flip side is, what if it is a true duplicate? So a true duplicate is an encounter that is the same event as previously reported. And in that case, you would void that duplicate encounter. So a void of a duplicate encounter must be submitted. So what this does is it doesn't erase the denied original, but it results in the encounter being viewed as complete by the system. It's not just an open-ended, unfinished encounter. So it's not just junk data. So, and in the spirit of data quality, that's something we really, really need to address. So, and I just want to remind you that 60% of denied duplicates have not been voided. So that's 955,124. I did give a different number. I redid the query and I didn't update my notes from day to day. Somebody submitted some corrections. So I get a lower number, but it's still 955,000. That's just for the past year. These are just sitting in the database. They're uncorrected. So I've been doing a pretty extensive analysis on the way to mitigate these issues. We're also discussing potentially other ways of trying to address this, including but not limited to developing triggers towards corrective action plans. This is very much on our mind. So this is a kind of a little summary of QMed for DRMT 001, and it's uncorrected denied encounters, which includes duplicates. So per the QMed, the expectation is 50% of denied encounters need to be corrected within 15 days. Now in this, we are talking about all denied encounters, not just duplicates. So 50% within 15 days is the expectation, and this will affect your QMed score. So, and then the next expectation is by 30 days, we expect 80% of the encounters to be corrected. Corrected meaning replacement or void. And within 60 days, we'd like QMed expects 95% of these encounters to be corrected. And the reason it's 95% is, if we look at the next slide, so DRMT1 measures turnaround time for denied encounters. How long does it take you to correct that encounter? And that's what that 15, 30, and 60-day scale is. But why 95%? Well, QMed allows up to 5% denial rate before grading. So 5% of the denials are just lopped off the top. And the reason we did that was because there are some encounters that are not correctable. For example, I've talked about replacements and voids. If a replacement or void is denied by PACES, it can't be corrected. It can't be fixed. It's just going to be, it automatically is a dead end encounter. So, and then also for invalid frequency code, it can't be fixed. So we're giving you 5% in the event of those to cover those uncorrectable encounters. We can't say 100%, but then give you a list of encounters that can't be corrected. So we give you that 5%. But plans are still expected to send voids and replacements for correctable denied encounters in accordance with the above timeframe specifications on the previous slide. So something I've noticed and something I've discussed with plans is that there has been occurrence, and I'm not going to name names, but there has been occurrence where plans are just not correcting these duplicate denials. And I understand, it takes time, money, you got to contact the provider sometimes. So they just kind of say, well, you know what, they'll just fall into our 5%. Well, that's not what the 5% is for. The 5% is specifically for denied voids, denied replacements, or invalid frequency code. So if you are just allowing those void encounters to just linger in the database because you're not going to be graded until 5% anyway, that really is not proper application. It doesn't help us with our data quality issues. So I really want to urge you to please correct those encounters one way or the other. And, like I said, we are looking at ways to mitigate this issue. And we're totally open to working with plans on this. That's what we're here for. Constantine and I, Christine, our manager, who we're totally committed to helping you. So if you have trouble encounters that you just can't get, that you don't believe are denials, then contact us. If you want a little bit more information on what the best method is for clearing these uncorrected encounters, contact us. That's what we're here for. So now we get to the nicer part. Okay, this is part of our guidance where I want to give you some ideas on how to prevent duplicate encounters. And I've actually worked with plans on them. So we'd like you to screen inbound and outbound encounters to ensure that they do not include duplicates. I know some plans do this. I've worked directly with a very sizable plan who was committed to doing this, and I provided them with the PACES logic, and we discuss the issue in depth to help them understand what it is we look for when we're screening these encounters at DHCS. So what they did was they developed an inbound screening system where all inbound encounters they got from the providers and then also from subdelegate plans, they screened them against their database. This way they can tell if they get a duplicate encounter from subdelegate plan or from a provider, and they can kick it back and tell them, hey, we've already gotten this one plan. I know there's a few plans that actually do this, but this one plan I worked with, they did this and it's working really great for them. Their duplicates have dropped significantly. We did this about 3 years ago, and it took them about a year to do, and so for the last couple of years they have had probably the best duplicate numbers of anyone. So they're screening, so they created an algorithm to screen inbound encounters. They also create an algorithm to screen outbound encounters. So they screen them coming in, and then they screen them a second time before they send them to us. And what this does is it ensures that we don't get a lot of duplicate encounters. So I'm just going to go down the list. Screen inbound and outbound encounters to ensure they do not include duplicate encounters. Systems inbound screening algorithms, systems to screen inbound algorithms. Such encounters should be returned to the provider for correction or void. So if you get inbound encounters, if you're screening inbound encounters and you determine, hey, these are duplicates, of course you're going to go back to the provider and say, you've already submitted these encounters. Please make sure they're duplicates. If they are not duplicates, then you'll need to use the appropriate coding. And and part of that is, like I was just saying, talk to the providers. So what we do with the plans also is what we're doing right now, employee provider education efforts, such as webinars, development of training materials. The plans, you have a relationship with your providers that we don't have. We contract with you, so we talk about this with you. There's nothing to stop a plan, and we actually encourage plans to provide education to their providers, whether it's development of training materials, sending them, an email with guidance on it, to talk to them, have a webinar, if a plan, I was going to say some letters. Okay, plan 1, 2, 3. I was going to say letters, but there is a plan with those letters, so I'm not going to say it. But plan 1, 2, 3 is, contacts all their providers and say, we're going to have a webinar today on duplicate encounters, or, some coding issue, diagnosis codes or something like that. Have occasional webinars. Determine what issues you're having with your inbound encounters, and then provide training to the providers, provide guidance to the providers, so that we can avoid these kinds of issues, especially duplicates. This should be the easiest to fix, really. And I've been saying that for years, because we know what a duplicate is. There's no weird coding involved. It's not like, well, we had to figure out what diagnosis code and what revenue code or this or that or for this encounter. And, this one is very simple. We've seen this encounter before. We have these in our databases. We can run checks against them. So it should be the easiest to fix. So I really would like you to encourage you to please take extra efforts because, I'm kind of tipping my hand, but in the near future, this is going to become a measurable and a measurable, even myself, it's going to be a measurable issue. We're going to be looking at this and we're going to be determining um, how we're going to encourage the plans. I'm just going to say encourage the plans to not submit duplicates. We're going to be looking at this. And if we have to work with you directly by volunteer or voluntold, we will work with you directly if we have to. So we really do want this issue to go away. It's the easiest issue to fix, and it's the number one issue. So that's kind of strange to me. The easiest issue to fix is the number one issue that we've had since the beginning of the project 10 years ago. So we're coming on 10 years of doing this project, this encounter data project, which was a federal mandate. So, let's say, how about for a 10-year anniversary, we really all focus on duplicate encounters. So. And so now I'm just going to get into some summary information. So these are our companion guides. This is our list of our most recent companion guide versions. If you don't have the most recent versions of these, you can go into the documentation center and download them to yourselves. If you don't now, that's open to all plant staff. It's even open to contractors. If you have a contractor that is providing doing your counter data files, they can access this too. And if you don't have permission or access to the documentation center, send an email to dataexchange@dhcs.ca.gov, and they will grant you access so that you can go in and always double check and make sure you have the most recent versions. Okay, so there's some more supporting documents. For example, and this one's really kind of an understated but really important. I think it's one of the most important documents we provide, and that's the PACES custom error messages. This lists all of the errors by code. Like the one I was talking about, 0x000cc, it lists all of the errors. And it gives a summary of what the error message is, and it gives the code, and you can look them up, and they're in order by the code number. And it's if you see an error code you don't recognize, you can go in and look in here, and this will kind of give you a summary of it. So coordination of benefits, the X schema. These are other documents that are also on the data exchange. So companion guides and implementation guides. Okay, this is an unfinished slide. I really want to apologize. It was another person who was going to be doing this, but she is out of the office. So she was going to talk about Loop 2003 and this issue that needs to be updated, but I'm sorry, I don't know it off the top of my head, so I can't let's just go by this because I can't speak on this. Okay, so contacts, if you have any question regarding encounter data, our email address is mmcdencounter@dhcs.ca.gov. Encounter data is in the name. And so anytime you contact your encounter data specialist, always include the encounter data email address as a CC. This is kind of our archive and our log. And if we have multiple people and one person is out of the office or something and there's an important email, then this box is monitored daily, and we have a backup who can handle anything that's extremely urgent. So, and again, for access to the documentation center, send a request to the data exchange email. So this says questions. Please review the DHCS quality monitoring and frequently asked questions page for guidance relating to encounter data. We are developing a frequently asked questions page that's in the Doc Center. And we're hoping to be able to answer some of the most basic questions, and also even some that are a little more specific, because we get a lot of emails. We have a lot of plans now. I think we're into like 40 almost 50 plans, with plans coming on every quarter or every year. So and those are just plan parents. We have over 200 individual HCPs, local plans that are part of those plan parents. We get a lot of questions. So if we can answer some of these questions for you without having to actually have an exchange, if you can just go in the frequently asked questions, then that might help. So I encourage you to look at the frequently asked questions document, and if you don't find an answer to your question, then go ahead and email us. So managed care and PACE encounter questions, send them to the DQRU mailbox, which is encounter data, and copy your specialist. For technical questions, data feed, send to the EDM data support. So, and of course, your feedback is always welcome. So, one moment, please.
All right. Well, thank you, Stephen, for your presentation. So next person coming up, we're going to have a presentation on HIPAA mandated standards, implementation, and companion guides. So I'll introduce Jeff Jennings, who is the chief of the Data Exchange Validation Unit.
Hi, all. Thank you for joining this webinar. Before I get started, I do want to make note that while this webinar and some of the previous ones have been heavily weighted towards managed care plans, we are aware that our county behavioral health plans are also on this webinar, and we will be sharing more information regarding, excuse me, regarding behavioral health and how that integrates with our managed care plans in the future. So some of this information is pertinent to behavioral health plans. As the integration effort proceeds, there will be more pertinence for behavioral health plans. I just wanted to make a note of that. Part of that is based on a question earlier. Does this information apply to all types of claims, specifically behavioral health claims? And I had answered not at this time, because those claims go through the short DOIL system. Behavioral health and medical managed care plans have operated in two separate areas for a long time. We are now trying to integrate. That's going to go on for a while. So if you are a county plan and you hear information in this webinar that concerns you, please ask for clarification. Now, with that said, I'm just going to briefly go over HIPAA mandated standards, such as the 837 claim, or standards that are produced by the standards development organizations, such as the 274 provider network data transaction, which county plans are familiar with. So this is kind of a high level short lesson in implementation, I should say, transaction standards, implementation guides associated with those standards, companion guides, how they work together. Next slide. So briefly, as I'm sure many of you are familiar with, Title II of the HIPAA Act in '96 established national standards for electronic healthcare transactions. It also mandated national identifiers and code sets. All of these mandated standards, code sets, identifiers are required to be used whenever the electronic exchange of administrative healthcare data is taking place. And the 837 claims encounter transaction is a good example of that. And again, right now, managed care plans and long-term care PACE plans submit their 837 encounters to the PACES system, while county behavioral health plans submit 837 claims to the short DOIL system. If that changes, we'll let you know about it. For now, that is staying the same. And then finally, Title II of HIPAA also designated specific standard development organizations. Those are the ones that maintain and develop items such as the 837 claims and encounters, et cetera, et cetera. Next slide, please. Thank you. So X12 is the SDO that develops and publishes data standards for the exchange of administrative healthcare data, which is most of the type of data that we deal with. And the 837 is a good example of that, as I had mentioned. So if you're submitting a claim or an encounter to Medi-Cal, DHCS, you are required to use the 837 claim or encounter. And I should say electronically. I want to also note that for some of our plans that submit data, the NCPDP 4.2 pharmacy transaction is required to be used. That is developed by the National Council for Prescription Drug Programs, NCPDP. Most plans are not submitting that at this time, but some of our plans are. Most managed care plans right now are submitting pharmacy data to Magellan, who is our pharmacy benefits intermediary, and a different version of the transaction is currently used. Next slide. So when a transaction is produced, along with that transaction from X12 especially, the guide that is produced to that transaction is known as the implementation guide. Implementation guides list the rules for each data element attributes, usage, etc. And that is for the entire transaction, the entire 837. Within that 837 transaction, there are specific data elements that we as a payer are allowed to customize to collect data that would be specific to state operations, etc. So when, as a submitter, plans are putting together a transaction, such as the 837, the references that are used to build a compliant transaction are both the implementation guide and the companion guide. The implementation guide gives the layout, as I said, for the entire transaction. The companion guide delineates and specifies for elements that can be customized what those customizations are. We make companion guides available in our documentation center and elsewhere for county behavioral health plans. They are posted to the DHCS SFTP folders. We may start posting those in the doc center, but that's something that is coming. So that's where companion guides are made available. Implementation guides are available elsewhere, and we'll talk about that on the next slide. So X12 publishes implementation guides for all HIPAA transactions that are numbered, such as the 837, the 835, the 274, the 834, the 820, the 277. There's a whole slew of them. The current version that has been adopted by Congress is version 5010. That's been in place for quite a while. X12 has actually developed more current versions and is currently going through the adoption process, which is a multi-year effort to have more up-to-date transactions adopted by Congress, which then allows us to all use those together collectively. I do want to mention that the 837 data standard has 3 variations. Stephen touched on that earlier. The 837 dental, which is specific to dental claims or encounters because it includes data elements that have to do with tooth surfaces and other dental specific data. And then there's the 837 institutional, used primarily for member visits to hospitals, facilities, that sort of thing, inpatient. And then the 837 professional, which is outpatient or visits to a particular provider, etc. We are not allowed to, please go back to the next slide, or the previous slide, thank you. Just to reiterate, due to copyright laws, DHCS is not allowed to share 837 implementation guides, or for that matter, implementation guides for any of the X12 transactions. Those must be obtained from X12. I've put a link in that can be used to find out more about obtaining those implementation guides. Most of them are now available in an online viewer. If you have additional questions, you can always contact me or the data exchange mailbox. If you've got questions about dealing with X12 or the Washington Publishing Company that is associated with X12. So we'd be happy to help you there. And then as far as our managed care companion guides, including the 837, those are currently posted to our DHCS documentation center. Access is granted by contacting the data exchange mailbox. We'll get you access right away. And if you do have issues with accessing the doc center, we will work on alternative methods for you to obtain those guides. So thank you very much. We are going to the questions slide next, and I appreciate your attention. Thank you.
Thank you, Jeff, for a wonderful presentation.
Oh yeah, you've got bad echo going on, boy. It's probably people in the meeting room.
Sorry about the echo, but yeah. So this is a question answer session, just going through the documents. We also have the and then we're also going through the chats. I see that a lot of people have been responding and asking questions. Thank you so much. If anybody wants to ask additional questions, please go ahead and unmute yourself, introduce yourself, and go ahead and ask your question.
You know, I'm going to jump in just for a moment and mention something about the documentation center. So it's another, it's based on MS Teams, yet another nifty Microsoft application. The way that Teams is set up is it's actually paired with SharePoint. So when documents are posted to the document center, they're actually posted to a SharePoint library. The result of this is that often links that are shared to the documentation center will have a SharePoint reference in them. As you can see in the chat, the link that Meishan shared has SharePoint. If that link doesn't resolve for you, let us know. We'll get you a link to Teams. It's a known issue to Microsoft. We're working on resolving that so that links, no matter whether they're SharePoint or Doc Center, always work. But we're not there yet. So just something to keep in mind. We do have a question from Kim at Centene, and this might be for Stephen and his team. Have there been any discussions about not counting void transactions towards timeliness measures?
Well, any discussions about not counting voids? No, we haven't discussed that because, you know, this is a data quality issue and we really do need those voids to maintain our database and not have a bunch of dead end data in there. So we also want to ensure that encounters are being completed. So I'll bring that up. I can't make any promises, of course. It'll be kind of a new conversation. But yeah, we haven't had that discussion. So I guess I can bring it up and we can discuss the possible merits of it and the pros and cons. So, and if it does get addressed, then you'll all be the first to know.
All right, thank you, Stephen. I guess that answers that question. I guess Kim Gowdy also said thank you. All right, does anybody else have any questions?
Okay, that's a question for me. Lissa Bayang from Kaiser asks or states in the documentation center, when I try to access it, I receive a message that says external. sharing is disabled. Listen, what might be best is if you can, if it's a specific channel or link to the doc center that you're having that issue with, if you can send to the data exchange mailbox, and you can always copy me, jeff.jennings@dhcs.ca.gov. We'll get you helped out with that. If it's the entire doc center, let me make sure you have membership in that and you're not receiving that message because we haven't added you yet. So I'll go check on that right now, but you can go ahead and follow up with any specifics in a separate email, just in case. If I can figure that out before we end the webinar, I'll come back and let you know. Right, and as Meishan has posted in the chat, that mailbox there is very much to be used for doc center related questions and items and so on and so forth.
We have a question from Eric Elevance from Health. If we have to send a void and a replacement, can DHCS consider penalizing plans on timeliness for one of those encounters rather than both?
Not if the void and replacements are done in a timely manner. I mean, mostly that's what QMed is currently scoring on, is the timeliness, the turnaround of that correction. If you discover you have a void and or a replacement, as long as they're, for example, well, I think, I'm not sure, but I've had this question before, phrased in a different way maybe, and I'm not sure if that's what you mean, but if you have to send a replacement in and then eventually you have to void it, QMed's only going to score you on the first one. It's not going to score you on the second one. So the second level void, it's only going to score you on the replacement. As long as your timeliness is good on replace, within 15 days, within 30 days, within 60 days, as long as your timeliness is good, then QMed won't well, I don't want to use the word penalize you, but it won't drop your score.
All right, thank you for that response, Stephen. So does there anybody else have any more questions before we move on? Hearing none, okay. So communication and resources. So we have a bunch of communication resources for you all. As always, the data group mailboxes, here's a listing of all the data group mailboxes available, such as 274 medical for physical health, 274 behavioral health plans, including MHP and DMC.ODS. We have a 274 dental mailbox, encounter mailbox, BH sort Doyle mailbox, PACE mailbox, etc. DHCS documentation, sender access requests, for general questions for ECM, CS, ECM, and JSON, and also MCDSS webinar support. When you send your message, if it's urgent, please mark urgent. And I see a question from Jackie Liu. Plans are required to submit large volume of replacement encounters related to target rate increases adjustments by the end of the year. Will DHCS consider to waive timeliness penalty on these replacement encounters?
That's an excellent question, and I was not aware of this target rate increase adjustment and having to replace encounters. But now that I am aware of it, I will discuss this with management and the PACES team, and we will determine what to do about that. I'll look into that, and if it's something that we asked you to do, I can't see penalizing you for something that we've asked you to do that is outside of our rules. I said I can't see. I can't verify whether or not that's true, but I don't believe that that would be the case. So, but I think it's something that I may have to bring up. So I will take a copy of these notes and I will talk to the people in charge of us, and we'll define that. We'll define that, whether or not that is going to impact you. But I can't see us doing that.
All right, thank you, Stephen. You got a bunch of thumbs up and hearts, so thank you so much for that. So onto this next slide, data security reminders. Per the Social Security Administration and CMS, all data related to these programs are prohibited from being viewed, accessed, processed, or stored outside the United States. As Medi-Cal data contains data related to federal programs, DHCS data privacy rules specify data related to Medi-Cal beneficiaries and cannot be processed, sent, viewed by entities or individuals outside of DHCS. For additional information on DHCS privacy, please click on the link below. And we have an additional question from Kim McNeely, but isn't the algorithm for excluding replacement encounters part of QMed v2?
Hi, this is Stephen again. And before I answer Kim's question, I want to elaborate on, expand on what Alvin was saying for the data security reminders. This issue is coming up right now, and we're actually consulting with our information security office and other offices here that determine our data security and all of our information security, our IT security and everything. So this is right now, as we speak, this is being considered, and this is something that we're going to be providing guidance for pretty soon, pretty quickly. This is a hot issue right now, as a matter of fact, and we're working on getting an answer for plans. And once we get the actual information on the data privacy rules from our information security folks, then we will be broadcasting those to all plans, and I anticipate that within the next couple of weeks. So moving on to the question, Kim's question was, but isn't the algorithm for excluding replacement encounters part of QMed 2? Looks like Debbie said, we will let you all know when QMed 2 is finalized. There is going to be a number of new measures for QMed 2, and I'm not really at liberty to speak about them right now because they're in development, and I'm going to use the overused term, it's a fluid engagement right now. We're kind of going, trying to zero in on what exactly we're going to measure in QMed 2. And I know that it will be expanded from QMed 1. And so I can't imagine, something with replacements, voids, or duplicates not being included in QMed 2. But that's pretty much all I can say on that right now. And thank you, Debbie. Yes, we will let you know when QMed 2 is finalized. It is a hot issue we're working on. We have working meetings every week on this, and we're committed to getting QMed 2 done. We're, hoping to get it rolled out sometime early in 2025, I believe. I hope I didn't misspeak, Debbie. But Debbie is our incredible branch chief, and she's infinitely knowledgeable and helpful. And I just hope that that compliment will get me out of trouble if I overspoke.
Oh, yeah, this is Debbie. No problem. I just want to make sure people know
All
and
right,
understand.
we just want to acknowledge Jeff Jennings. You got your hand up.
Yeah, I want to go back to that data security reminder, and I suppose ask, because wasn't that prompted by an attempt to upload 837 file to FTP folders and from outside the country, and there was a denial? Wasn't that part of the issue that prompted this question? Because according to our Internet Security Office rules, accessing FTP folders from outside the US borders is currently not available. So I just wanted to make note of that.
Okay, thank you, Jeff. And then Debbie, were you speaking on something?
Yeah, I just want to make sure I'm unmuted here. Yeah, just to follow up on Stephen's point, we just want to let everybody know we are working on QMed 2.0 and looking into various ideas and issues and new measures. And that, of course, has a whole approval process. And that's something that we would bring forward to the plans as well. So all of these thoughts and ideas we take into consideration. We just aren't far enough along to give definitive answers at this point, but keep in mind that we are working through the new measures, and whatever we come up with would be a collaborative effort.
All right, thank you, Debbie, for your input. We do have an additional question from Terry Compiègne. Can DHCS share the documentation / publication regarding data privacy and offshoring? The link provided does not take you directly to the law guidance and publication.
That is what I was referring to when I said we're going to be sending out this guidance very soon. We're working with our information security office to provide specific citations or the specific rules, regulations, or policies that affect this issue. So we will be sending that out, and it'll be sent out probably within the next week or so. One more note is please expect that information to come from your contract manager.
All right, thank you, Stephen, for your input. There's an additional question about accessing the recording for this meeting. Just a generalization. It goes through different processes for the recording to finalize. So once this is done, we will post on the website. Don't have an exact time frame, but definitely we will let everybody know when this recording will be posted on the website. Thank you. Okay, and resources. This is the resources page for the DHCS Quality Webinar Series page. That is the link to directly go to the resources site. And as additional resources, the webinar series, once this is finalized, will be on the page as you see below. But also too, we have past webinar scheduled series that we've done within the year. So they're all posted along with the links. So there you'll find the recording, script, PowerPoint, slide decks, upcoming webinar schedule, the distribution list link. So if you have people that have come and go in your organization, please let the team know and we will update the list for you guys. We also have frequently asked questions and also glossary. And once again, I would like to thank our presenters today, Stephen Lefebvre and Jeff Jennings, for your presentations, and also the webinar team, and also everyone for your participation for today. Thank you very much. Have a good day, and we will see you next month. Thank you, guys.